Hello, welcome to the Stress and Distress Dementia webinar series. This series has been developed by the Department of Clinical Psychology, Older Adult Mental Health Service in NHS Grampian. This module is Proactive and Preventative Strategies. Proactive and preventative strategies include anything that is implemented to prevent stress and distress. Instead of responding reactively when stress and distress tends to occur, proactive and preventative techniques are implemented before any distress occurs, and this will decrease the likelihood of escalation. Proactive and preventative strategies promote person-centred care. In order to reduce an individual's distress, we first need to understand the causes of their distress. And if we know what triggers a person's distress, we can then try to reduce or eliminate this trigger to reduce the likelihood of the person becoming distressed by using proactive and preventative strategies. If we know the cause of a person's distress and we notice that they have then become distressed, we can intervene early to reduce the cause, whereby reducing the distress. Let's consider how we might put proactive and preventative strategies into place with an example. Initially, we want to hypothesize and try and consider what the cause of distress might be for the person. This will be based on what the person is telling us, what we know about them, and what we observe. So in the example here, the person was seen grimacing during personal care. They required additional assistance while walking. And we also know from their historic medical notes that they had a complicated hip fracture a few years ago. So we hypothesize that the person may be in pain. We then need to agree if further assessment is required to establish if our hypothesis is likely to be accurate. Further assessment might involve behavioural charts, observations, or utilising outcome measures. In this example, the staff team agreed that further assessment would be helpful, and they used the Abbey Pain Scale. Once we have established an informed hypothesis of the person's distress, we can then consider person-centred, proactive and preventative strategies to put into place. In our example, as we established that the person was likely experiencing pain, medical staff prescribed pain medication to be taken regularly, and care home staff also supported the person's personal care differently when assisting them with showering and toileting. We found that these proactive and preventative strategies led to reduced distress for both the individual and the staff team supporting them. Using proactive and preventative strategies to reduce the likelihood of distress occurring or escalating leads to less distress for the individual, reduced stress and distress for us as staff members, and it also leads to the reduced need for medications that may have adverse side effects, including falls and increased mortality. This diagram can help us to visualise how distress may occur. If we can intervene early using proactive and preventative strategies at the early warning signs stage, we will be better equipped to prevent distress from escalating to crisis point. As you can see, initially the increase of distress is quite slow. If we leave it too late to use proactive and preventative strategies and instead try to intervene in the escalation phase, it may be more difficult for us to help reduce the person's distress, and it's likely to be more distressing for us as staff members. If we consider our earlier example of the person who's experiencing pain, if we can imagine, offering pain medication at crisis point probably won't be that helpful because the person is already experiencing significant discomfort. It's therefore more helpful to provide the pain medication during the early warning signs, as this will prevent an increase of the person's experience of pain, discomfort and distress. This slide will show some examples of proactive and preventative strategies. We would encourage you to consider if these are currently being implemented in your place of work when someone presents with stress and distress. This list is not exhaustive, so there may be additional things that you would like to consider in your place of work. It's helpful to think about the noise levels. Is the environment too noisy or too quiet? We also want to ensure that we're maximising communication. Are communication aids, such as glasses and hearing aids, being worn, and are they clean? A consistent routine and approach across the staff team can also be helpful. It's therefore important to also consider how this consistent approach might be communicated between work shifts. We want to ensure that we're providing opportunities for meaningful activity. What is important to the person and what do they enjoy doing? As we discussed in our previous example, pain management is also really important, so ensuring that pain is being managed appropriately is a proactive and preventative approach in itself. Is signage in the environment in the person's home appropriate? Are they able to recognise their own room, their own space, the lounge and the dining area? Are names and words placed on signs, or are images also being utilised where possible? It can also be helpful to consider the layout of our environment. Is the place easy to navigate, or is the person likely to get lost? Again, can we use signs to support them? We also want to consider lighting. We know that dementia can cause changes to a person's sight and vision. They may need additional lighting in certain areas where those of us who don't have dementia can see fine. We also want to ensure that the person's basic needs are being met. Are they hungry, thirsty, or require the bathroom? People with dementia may have difficulty with communicating their wants and needs, expressing what they are feeling, and understanding what we are communicating to them. We can maximise communication by using lots of different strategies. Here is a list of some of the really common ones. We want to use simple questions, so those that require yes or no responses can be really helpful. We want to smile and nod to show the person that we are listening and that we're trying our best to understand them. It can also be helpful to give people choices if they're still able to state what they want, but we want to keep the choices limited. So for example, we might ask someone, do you want to play dominoes or balloon tennis? Rather than asking an open-ended question such as, what would you like to do now? The use of visual prompts and cues to show the person what you're talking about can also be really helpful. So for example, while supporting someone with personal care, we may want to show them the shampoo bottle before we wash their hair. We also want to try our best to keep things positive, and it can be helpful to speak about how someone might be feeling, rather than arguing or discussing facts that they might not remember. Some things that are helpful for us to avoid when communicating with someone who has dementia are asking too many questions all at one time. We also don't want to ask too many questions that rely too heavily on a person's memory or problem-solving skills. We also want to avoid correcting the person where possible. If someone gets a word wrong or maybe misremembers something, what happens if we just leave that and allow that to be? We're probably going to find that that's more helpful and will increase our therapeutic relationship and alliance with the person. And we also don't want to get into arguments about facts. Let's look at a proactive and preventative strategy in more detail. This strategy is validation and distraction. Validation and distraction is a two-step approach, so let's look at step 1. Step 1 is validate. We want to acknowledge how the person is feeling, empathise and listen to them. Consider if we can meet the person's needs and accept the person's reality, even if their reality doesn't quite align with our own. We also want to support the person to feel safe and secure. So some things that we might say while validating is, I can see that you're upset. Is there anything I can do to help? If we are unable to meet the person's needs at that moment in time, state something similar to, I'm sorry that I can't meet your needs right now, or I'm sorry I can't do that for you just now. Let's think about step 2 of the validation and distraction technique. Step 2 is distract. We want to divert the person's attention away from the stressful event. We also want to encourage them to focus on something that is more pleasant and calming. Here are some examples of how we might distract someone. We may say, it's almost lunchtime, let's have a look at the menu together. Or if we have our patient information, we might say, why don't you tell me about your grandchildren? Or something else that we know is important to them. The validation and distraction technique can work really well as a proactive and preventative approach. However, we must ensure that we're utilising both step 1 and step 2 of the technique. This document has been developed by Alzheimer's Scotland's network of dementia nurse consultants and the Scottish Government. The Getting to Know Me document aims to give staff a better understanding of patients with dementia. The document asks for brief information about the person, such as their likes and dislikes, their background, what they like to be called, the important people or places in the person's life, the things that help them relax, how they take their medication, what their normal routines at home were like, if they wear glasses or a hearing aid, what they like to do for themselves or independently, and what things they might need help with. There's also a space for carers to add in relevant information that they think other staff should know about the person. This all helps us to provide the best care possible and to better understand any stress and distress behaviours that we may observe. Thank you for listening. If you require additional support in managing stress and distress, please contact your GP or community mental health team for further information. Thank you. You have now completed proactive and preventative strategies. Please move on to the next video.